The Association of the United States Army is pleased to welcome you to AUSA's Noon Report webinar series. This webinar series features presentations by senior Army leaders responsible for key programs and initiatives. It also features contemporary military authors who weave together the past, present, and future story of the United States Army. Kicking off today's webinar is AUSA's Vice President of NCO and Soldier Programs, retired Sergeant Major of the Army, Dan Daly.
Good afternoon, and welcome to the Association of United States Army's Noon Report. Thank you for joining us for today's webinar. We appreciate your support as partners in the defense of our nation. Joining us today to discuss the Army's efforts to develop and implement an integrated prevention system to address harmful behaviors such as suicide, sexual assault, sexual harassment, and substance abuse is Dr. James Helis, Director of the Army Resilience Directorate. For those joining us online today, please take advantage of having Dr. Helis here to ask questions. You can use the Q&A tab on the right side of your screen to submit a question. After discussion, we will take as many questions as possible. You can also find the full bio for Dr. Helis and our moderator, CW5 Phyllis Wilson, U.S. Army retired and AUSA Senior Fellow, in the Handouts tab. Our moderator, Chief Wilson, served as the 5th Command Chief Warrant Officer for the United States Army Reserve. She is the President of the Women in Military Service for America Memorial Foundation and serves on the boards of directors for the Allied Forces Foundation, the Army Women's Foundation, and the Association of the United States Army, where she is also a Senior Fellow. Chief Wilson, I'll turn the floor over to you.
Thank you, SMA Daly. Dr. James Helis was appointed to the Senior Executive Service in July of 2012 and has served as Director of the Army Resilience Directorate since March of 2019. He was an infantry officer with the United States Army for 30 years and has served in a number of leadership positions in the defense world since his Army retirement in 2009. Dr. Helis, thank you for joining us today.
Thanks, Chief. It's great to be here, and thanks, SMA Daly. Great to see you again. Today we want to talk about integrated prevention, and before we get into prevention, I think would zoom out a little bit to talk about people first and how we as an Army are going to go about doing a better job of taking care of our people. And I think the first step is recognizing that when we talk about people and mission, which sometimes often we do, that's a false dichotomy. We have to build into our mindset that people are the mission. We pay close attention to the maintenance status on tanks and aircraft and other systems, but people are our most important weapon system. They're our most valuable weapon system. They are what give us the edge against any opponent or adversary that we might face. And so we need to pay as much attention to taking care of our people as the equipment. Now, people are much more complex and it's much more sophisticated. It takes engaged leadership, it takes knowing your people, it takes understanding what are their challenges, what are the problems they face, what are their talents, what are their ambitions for life, why are they in the Army and what are they hoping for, and helping them to realize their goals and dreams, and helping people through challenges and rough spots. And everybody has those. We tend to think, the E1 to E4, maybe 5-6 population, but all of us in life at some point or another go through challenges, and we have to learn to take care of each other. We have to learn to ask those hard questions about how are you doing, the check-ins, and on the other side of it, when somebody asks how are you doing, that's not just rhetoric or just not something that people are throwing out. If there's something going on, tell them. Okay, talk to them. Let them know you're human. Let them know what's going on. There's no shame in admitting to challenges because we all face them at different times in our lives. And let your buddies and your friends be your buddies and friends and take care of you when you need it. So we talk about prevention, we really mean start off with people first and taking care of people, and that people are, in fact, part of the mission. There's not a dichotomy between the mission and the people. Major step that occurred in this when SecDef Austin assumed office in January of 21, his first directive was to get after the challenges of sexual assault and sexual harassment in the military. These are behaviors that split unit cohesion, that harm soldiers, and they just cannot be tolerated within the military. They're just so contrary to our values. So he stood up an independent review commission. The commission met for March and into the summer. We received the roadmap and the guidance and direction from them last fall, and we're in the process of beginning to implement. It's a large, complex undertaking. The commission provided over 80 recommendations. There were over 30 action plans required of each of the services for implementation. Some of those fall into what I would call, things that we do normal business, updating our curricula for professional military education to better address prevention, looking at our selection processes for senior leaders, as we've already done with the command assessment programs that are run out of Fort Knox for battalion, brigade, leader command teams. So it's stuff that we're doing, but it gave us a bit more focus to it and gave us a little bit more granularity of expectations and support. The three biggest changes that I think are going to come out that we're going to see as a result of the IRC involve military justice, the organization of the Sexual Harassment, Assault, Response and Prevention Program, SHARP, and the creation of an integrated violence prevention system. So to start with them, military justice reforms were recommended in the IRC report. They're also included in the 2022 National Defense Authorization Act. Essentially, a certain family of serious crimes will move from the purview of commanders to the Office of the Special Trial Counsel, OSTIC. That body will stand up, OSTIC will stand up sometime this summer, in summer of 22. It will become fully operational in December of 23. The way the NDAA was written, this is the throwing an effect of a switch that if a crime occurred prior to the operational date in December of 23, it will be investigated and prosecuted under our current system, with commanders having the responsibility to make the determinations of whether or not a case goes to court-martial. After that, that responsibility will transfer to OSTIC. They'll begin building the infrastructure over the next year and a half, putting personnel in place, developing policies, procedures for implementation. So it will be a well-considered, well-thought-out, deliberate process before we make these major changes to how we administer military justice. Second is reorganization of the SHARP program, particularly the victim advocates and sexual assault response coordinators of the VAs and the SARCs, the people who are on the front lines of taking care of soldiers who are victims of sexual assault and sexual harassment. The major change will be that instead of reporting to their brigade commander, the SARCs and VAs will now all at an installation report to a senior sexual assault response coordinator who will in turn report directly to the senior commander. Now, the SARCs and VAs will remain embedded in the brigade footprint, akin to how our embedded behavioral health teams come out of the MTF but embed themselves in the brigade's footprint, so they're visible, they understand the unit, and they're more accessible to soldiers. The same thing with the SARCs and the VAs. They'll be embedded in the unit, part of the formation, but their reporting channel will go to the senior SARC, who will report to the senior commander. Also in the reorganization, we will begin phasing out, next year we will begin phasing out collateral duty positions. To facilitate this, the Army Manpower Analysis Agency is conducting a major workforce study that will be completed, we anticipate, in September of this year. That's going to look at what are we going to need to do in terms of supervisory structure for the SARCs and VAs. Pick a place like Fort Bragg where you've got over 60, one senior SARC can't possibly supervise all of them, so how will we create the structures to provide the leadership and supervision for our prevention workforce? For the phasing out of collateral duties, what we're going to look at is, okay, what kind of a permanent workforce are we going to need to add on to maintain the coverage, to cover the workload, and to provide continuity of care for victims as we go through that transition. And again, we expect that staffing study to be complete in September, and we expect to make recommendations to the Army senior leadership in December. The third component is the prevention workforce. And this is probably the largest and most complex undertaking out of the Independent Review Commission requirements. It To create a prevention system, an integrated prevention system, you have to have a workforce that can put that system into place and make sure that it operates. It's going to remain a command responsibility, but one thing we've seen is that commanders right now do not have either the capacity or the specialized capabilities and skill sets that it takes to put integrated prevention to work at our installations. Some places, such as Fort Hood, where I was visited last week to see their People First Center, are taking steps to move in that direction, but all of the staffing is coming out of Hyde. It's borrowed military manpower, and what we want to do is create a permanent civilian workforce so we can put the troops back in their units, the leaders back in the units where they're needed most, and provide this prevention system through a dedicated workforce. Now, we often get asked, what will the prevention workforce do? One thing that they're going to do for commanders is provide an analytic capability. The Army collects lots and lots and lots of data. And a struggle that our commanders have right now is having the time, the space, and the people with the skill set to analyze all of the data sources. The command climate surveys, the Commander's Risk Reduction Toolkit, which pulls 30 different databases into a single system for commanders, crime reports, all of the data you could gather on an installation. And the workforce will be able to examine it, synthesize it, and make recommendations to the commander on where are the risk factors at this particular installation in these particular formations, where are the protective factors, and what are the kinds of activities that we can implement here at Fort Hood, Fort Bragg, Camp Humphreys, wherever, to get after mitigating, reducing risk, and enhancing the protective factors. They also give the commander another set of eyeballs. They can conduct pulse surveys. We found that was very effective at Fort Hood when the Fort Hood Independent Review Commission went in and conducted a short survey on climate within specific items within Fort Hood. They can do focus groups, they can do listening sessions, but again, they can be eyes and ears and collect information for commanders, for leaders on what's happening at their installation, again, to inform how commanders go out about in an integrated way of creating healthier communities, a more positive climate, and taking better care of soldiers. The whole point of it is to try to get to the left on the timeline of the event. We train soldiers for crisis intervention. If you see the warning signs that somebody's showing warning signs that they're about to harm themselves, perhaps attempt suicide, we teach them how to intervene at that point. We teach them if you're at a party and you see certain things going on, these are warning signs that a sexual assault might be in the works here, and techniques you can use to intervene and diffuse the situation. We need to move left of that. We need to get ahead of problems before they become crises. So we have to build positive climates where everybody truly treats each other with dignity and respect, where seeking help is seen as a sign of strength, not as a sign of weakness, that you're not burdening the unit by taking the time to take care of yourself, whether it's with financial counseling, marriage counseling, behavioral health, parenting skills, that's important to the unit, because we need you as a soldier to be at your best every day. And sometimes you're going to have to unplug to take care of some issues that are affecting your life, that are affecting your focus, your concentration. Again, we don't have a problem taking a tank and pulling power pack, or taking a helicopter apart to get the avionics, make sure that they're tested and straight. We need to take the same kind of attitudes towards our people. A couple of places, Fort Riley has tested, Alaska's in the process of testing annual wellness checks for every soldier through the military family life consultants, where everybody, starting with the commanding general in both places, is going to go and check in and have a 30-minute session to just do a check-in and how are you doing in a confidential environment where you can talk about whatever's going on in your life. And if there are things that are happening that you can get advice and support of, okay, here's somebody you might want to see, here's a referral for help, or some coping techniques. So again, to circle back, it all comes back to people first and taking care of our people and understanding that people are the mission, and that we have to do a better job of taking care of our people and preventing the harmful behaviors that impact their ability to be the best soldier they can every day, which in fact impacts readiness, cohesion, lethality.
Wow, thank you. So, as Sergeant Major Daly had said earlier when the SMA was introducing me is that I had served as the Command Chief Warrant Officer for the Army Reserve. So what I heard was quite a bit of Compo 1 talk. So can you sort of elaborate a bit more on Component 2 and 3, the National Guard and Army Reserve? More than 50% of the Army is comprised of that, and they're not on posts and installations many times. So what's the outreach looking like for them?
You're right. We have to have different models for the Army National Guard and the Army Reserve. They are implementing the same recommendations of restructuring the sharp workforce, although collateral duty positions are likely to remain in most of our reserve component and guard units because of the geographic dispersion and the practicality of trying to find more full-time coordinators. They're hiring a prevention workforce, so they're doing all of the same things. Now, to step back, the Guard's model for staffing these positions and implementing these programs is going to be based on a state model, 54 states and territories. Within the Army, we're basing it around the senior commander at installation. The Guard is going to base it around the tag at the state and territory level. And again, part of this is, a state like California, very large, with a very large Guard and Reserve component population, is going to require much more staffing and support than Rhode Island, where everybody's in a very tight catchment area. So the Guard is going to be basing it around the states and the territories and working out of the TAG's office. And they'll be a little more joint because the TAG's office, it's a joint force headquarters at every state right now. The Army Reserve is going to be doing the same in a hybrid model. It's going to be the resources are partly going to be organized on a regional basis around the 4 readiness divisions and breaking basically the U.S. up into 4 quadrants from northwest to southeast, and then incorporating those overseas elements. But they will also put components in at the major command headquarters, because you can have a command that may be headquartered in Illinois, and they've got soldiers all over the east of the Mississippi part of the U.S. So giving the commander the capability to see her or his formation and provide direction and guidance for leaders, but putting the lower level resources at a regional basis so they're more accessible. You could go in a community and there's 5 companies in there that belong to 5 different brigades. And so that's where the regional support would work. So theirs is going to be a hybrid model, but you're absolutely right. All of these steps are being pursued in the Guard and the Reserve. It's all components, it's all soldiers.
Thank you for that. Another thing that you were talking about is certainly, when we think about our other equipment, whether it be major components or systems, and when they need to be updated or refreshed, nobody thinks anything about it. And, if we jump out of an airplane and break a leg, which we certainly don't want to do, but if something like that happens, everybody around us understands that there's some care and treatment associated with that limb now. But somehow mental health does not get the same kind of buy-in in many cases. Do you think that senior leaders are stepping forward enough and sharing some of their own personal struggles that sort of give us all that sense? Because as you know, as an infantry soldier, even myself, I was military intelligence, but always trying to be, that really good soldier. And so it was more of a suck it up cupcake mentality than when you need to seek that kind of support or report when somebody is harassing you, you feel like you're not being the best of soldiers. How do we get past that?
You're right. To quote from the SecDef, behavioral health is health, and we need to start thinking about behavioral health again the same way you talked about as an orthopedic injury. Because I was one of those guys who jumped out of an airplane and had a bad landing, and walking around with a cast, everybody understood how it happened. And it's just, I've got to get myself healed up, go through physical therapy to get ready so I can go back out the door of an airplane. So there's not, we accept that. We don't expect that someone is going to go down to the motor pool and help, pull the power pack on a tank if, they've got their arm in a sling. But we don't think of that as behavioral health because it's not as visible. And I think as warriors, we tend to think of, I'm tough, I can gut through this. You realize I can't gut through a broken leg, or I can't, gut myself through, a torn rotator cuff. But you want to think I can gut through a personal, this mental issue. And we need to change that mindset. We need to change the mindset to where seeking behavioral health is the same as seeking any form of health care. And I see senior leaders talking about this. I see senior leaders talking about it more. talking more with their soldiers about, how they have sought behavioral health. I have sought counseling as a commander. When there were some really high stress periods, I found it helpful. It is not seeking help should not be stigmatizing. There's no stigma to it. The biggest stigma that we see attached to seeking behavioral health from soldiers is no longer this is going to affect my career, although there's still that perception in some parts. The biggest stigma that we hear from soldiers about behavioral health is I don't want to let my buddies down. And so I can be there. I think I can tough my way through it. And that's what we have to overcome, is that behavioral health is just like any other form of health. It's like having the flu. It's like having a broken leg. It's health. It's a medical issue, and you need to get the proper professional care to see your way through that.
Are there any metrics yet with regards to those that related to suicide and mental health, or lack of seeking the care of mental health? And is there any way that we can find it, some correlation that says those that do reach out for support on the health side for mental situations, we also see a decrementing then in the suicide? Or is there any way for us to really know?
It's really hard to dig into. We look at soldiers, and within soldiers who die by suicide, we see about half have had an engagement with the healthcare system within close proximity to their death. May not have been behavioral health, but we always do the safety check and try to look at soldiers in a medical engagement as to, okay, how are they doing? Are they at risk? So it's very hard to peel that apart. Research in the civilian sector, the private sector, says about half of people who die by suicide have not exhibited symptoms or signs of a behavioral health issue, so that it's not necessarily connected to behavioral health. There are certainly cases where behavioral health plays a role, but there are other cases where we don't see that connection. In future things, the 2022 National Defense Authorization Act directed the Secretary of Defense to convene a Suicide Prevention and Response Independent Review Commission akin to the one we had last year on sexual harassment and sexual assault. That commission was introduced last week. They're beginning to put their plan of action to work. The services have all briefed them on our current programs and our future plans for suicide prevention. We expect the commission is going to start making their installation visits in July. Tentatively, they're looking at going to Fort Campbell, Camp Humphreys for Army, and going to Alaska to visit all of the bases, Eielson, Wainwright up in the interior, where you'll see an Army and an Air Force base in the same, and then down to Anchorage to J-Bear to visit Elmendorf, Richardson, and visit a joint base. And their report is due in December. Okay. And they do have a number of behavioral health experts in it. One of the senior consultants is General Dr. Nadja West, former Surgeon General. So that is going to be one thing that I think that they're going to be looking into is the clinical, the behavioral health side.
Thank you. One of the questions that's been sent in, it says, what are you doing to prevent sexual violence, especially in light of the findings from the Fort Hood Independent Review Committee and the DoD 90-day Independent Review Commission?
The strongest connection we see to sexual violence and sexual assault, if you're looking at a unit, is the presence of sexual harassment. There's a strong statistical, data-proven correlation. If you have higher events of sexual harassment, you're going to have higher rates of sexual assault. So one is to put a greater emphasis on preventing of sexual harassment, which normally occurs in the open. For women particularly, it occurs in the open, in the workplace, and putting the responsibility and making leaders understand that you have to immediately correct that. If you hear or see something that is out of place, you need to make an immediate correction. That we don't talk like that here, we don't speak like that here, that's contrary to the way that we do things in this squad, this platoon, this company. That's the first step, is you want to move to the left, you want to get it early and show that there's no tolerance for the mistreatment of any soldier, particularly with a sexual context. That's one step. Second step is going to be, again, looking at the prevention workforce is how do we approach prevention in an integrated way, because there are common overlapping risk and protective factors that we've seen for suicide, sexual assault, etc. But again, the first and most important is to get at the sexual harassment, which is a visible public, typically for women, a visible public behavior, and just say stop. And that sets the tone.
And you're so right. It is a continuum from sexual harassment that, when left unchecked, it will migrate further and further down to where it becomes what we call glad handing, somebody grabbing of, you know, leering, those kind of things. But you know, when I ultimately made more rank, sometimes some of the junior women would come to me and say that so-and-so had made them feel uncomfortable. They didn't, and they didn't have the gumption to go and speak to them. Okay, let's go do this. So we'd go have that conversation. But many times, I will tell you, the men in the military, they didn't see it as like, what's the big deal? I was just making a crude joke or something. And she needs to get a tougher skin or those kind of things. And so, you know, there becomes this problem where it now goes back to the person that says, hey, wait a second, I'm not comfortable with that. We're not talking necessarily about something as simple as a young soldier and his bride went to Hawaii for their honeymoon, and that young soldier and his bride, he has a photo of them on the beach, and some woman may come by and say, that makes me feel uncomfortable to see that man and his wife in swimsuits on the beach in Hawaii. You need to take that away. So that's where it becomes a problem, I think, at times. You know, do we then tell that young soldier who's proud of him and his wife in the Hawaii photo, that needs to go away, not in the workplace? Where's the defining line, or where will you see this going to in the future?
Yeah, it's a great question about the line, because, you know, it often is in terms of, you know, the victim. Do you feel, you know, that you've been affronted? Do you feel that something is inappropriate within the workplace? And it's an education issue, you know, because, you know, we recruit our soldiers from society, and, you know, sexual assault and sexual harassment are not unique to the military. And data talks to us about how many high school students, how many teenagers have experienced some form of sexual harassment or abuse, or, you know, even sexual violence before they enter the military. So we have an education process that we have to, you know, keep our foot on the gas forever, because we're bringing in over 100,000 new soldiers across the three components every year, and we have to bring them in line with the Army's values, and what is right, what is wrong, what is acceptable, what isn't acceptable, you know, and how we expect them to behave. And we start that in basic training, but that has to continue on, you know, in every new unit of assignment. There's got to be a setting of here's the boundaries, and here's how we expect you to behave and to conduct yourself.
One of the questions I see, it says, what has changed that caused the increase in sexual misconduct? And I wonder, actually aloud, before I allow you to answer, is there an increase in sexual misconduct, or are we seeing an increase in reporting?
Between 2018 and 2020, the every 2 year survey done of prevalence of sexual assault and sexual harassment in the military, the rates of sexual assault in all of the services went up dramatically between 18 and 20 by a quarter to a third. That was a significant increase. Within the Army, we saw that increase. We saw sexual harassment stayed relatively flat, but it was about 24%. You know, 1 in 4 women reported, you know, estimated, experienced some form of sexual harassment in the previous year, which is a completely unacceptable number. The 2020 survey was not conducted because of COVID, because we felt because of all of the changing conditions that the data would not be reliable. So DoD conducted the survey between December and March of 21-22. Data is being analyzed. We expect to see the report out by September. I haven't seen any preliminary data, so I have no idea where it's going to go. But we'll see if the steps we've been taking since 2019, when we received the previous report, have caused a dip in prevalence. Reports have gone up. Reports went up significantly in fiscal year 21. You know, and you're always looking at, is that because we've seen an increase in misconduct and a proportional increase in reporting, or are we seeing an increase in reporting because we have, at all levels, from the enterprise level down to the local level, we've encouraged soldiers to report, and we've gained increased confidence in the chain of command that your report will be taken seriously, you'll be treated with respect. That's the optimistic, that's what we would like to think. And again, in a couple of months, we'll have a prevalence survey that will tell us which way that, if our efforts since 2019, when we got the last report, have driven down the rates.
With what frequency do you receive similar kind of reporting and metrics with regards to death by suicide?
We can track death by suicide. I mean, we literally track it daily. And so, every day we look at death by suicide. The same thing with reports of sexual assault, harassment. I mean, those occur in real time, and we can track those on a daily basis. And in both cases, we can go back and say, where are we, in calendar year 22? We measure suicide by calendar year. Where are we in calendar year 22? Where were we in 21? Where were we on average the last 5 years on, let's say, the 24th of May? Mm-hmm. So we can track that in real time. The longer look we took, the better the data. Where are we compared to last year? Last year was about the worst year the Army has ever recorded. We are seeing a decline this year, so that's a positive sign. Hopefully that will sustain throughout the course of the year. Guardedly optimistic that we're moving in that direction.
Do you think that COVID and the teleworking and those kind of issues, what's the correlation with COVID and then this uptick in death by suicide for last year? Do we have any idea?
We have some idea, but there isn't we can't show a direct correlation between COVID and the increases in deaths by suicide. We did see increases in depression, anxiety among soldiers and family members. We saw an increased demand for behavioral health services. Surgeon General did a fantastic job moving to tele-behavioral health, mm-hmm. which resulted in greater capacity for appointments and in fewer missed appointments. Soldiers felt comfortable. You could do it on your mobile device. Mm-hmm. You could do it from the privacy of your room, as opposed to saying, "Hey, I've got to go halfway across post to the clinic or to the hospital for care." So that was definitely a positive step by the Surgeon General. But if we go back pre-COVID, if we go from 17 to 18 and 18 to 19, we were already seeing a rise in the rates of death by suicide within the active component, and that continued through 20 and 21. Did COVID affect it? Again, there's no evidence or data that we have yet that shows that COVID affected mm-hmm. The rate of death by suicide within the Army. Nor do we see any evidence that it affected rates of death by suicide outside of the Army, although it did increase anxiety and depression.
That's always the thing. As a senior leader in the Army, I think, that sense of you're trying to get some kind mm-hmm. of data point that can steer you in mm-hmm. the right direction. How do we mitigate these things? And as much as we try and we do our, mm-hmm. whether it's X number of push-ups or a yep. distance ruck to bring awareness to soldier and veteran suicide, but it feels like we're not getting our arms around it. Is there a methodology that we're missing and something that we can do differently?
We have looked very deeply into the data and into the statistics around death by suicide in the Army. We, in the Resilience Directorate, we recently, working with the Institute for Defense Analysis, we're going back and looking at the 15-6 reports, the formal reports done, investigations after death by suicide, to have an outside set of eyes look at them to say, is there something that we who've been looking at this problem for many years are missing? Is there something that we're not picking up on? Because again, the amount of study and time that's been invested in this challenge has been significant, and sometimes you get so close to the problem that you may not see it. One thing we've seen has changed in the last decade is deployments. In 10, 15 years ago, we were seeing that there was a relationship between numbers of combat deployments and suicides that may have been prompted by post-combat stress or PTSD. Now, for a soldier to die by suicide, most of them have either 0 or 1 deployments. So, but the rates continue to go up. So there's something out there has changed in terms of the stressors on our soldiers that we're seeing. 2 years ago this month, the Vice Chief of Staff took on, okay, we're going to address this in a comprehensive, deliberate fashion. We had monthly VTCs with the senior leaders of the Army down to division command level. We looked at best practices. We brought in soldiers who talked about the training they'd received in interventions. We talked about, we looked at specific cases to, okay, what could the unit have done better? Were there warning signs that were missed? That culminated in a chain teach by the Vice in December to the senior commanders with we're going to chain teach on suicide prevention at echelon all the way down to squad. It was not as you and I experienced too many times, here's a chain teach, here's a deck of slides, and everybody from the CG down to the most junior private right out of basic training gets the same level of training. The requirement was that commanders and leaders would develop the training they felt was appropriate for their unit, for their soldiers, and this was completed in the spring. We've talked a lot more about engagement with soldiers, and this is my squad, and being engaged with your soldiers and engaged leadership. So all of that effort over 2 years, we're now seeing a decline in the rate. And again, not even halfway into the year, but guardedly optimistic. And I would say part of this has been that the increased focus on it, an intentional, ongoing focus on the problem, and an ongoing focus on engaged leadership, better engaged leadership, to know your soldiers, identify their challenges, and get them the support and help they need before something turns into a crisis.
Exactly. I have another question. It says, how specifically are resources being directed to help survivors of sexual assault?
Every survivor of a sexual assault is provided with a victim advocate. And the victim advocate's only job is to advocate on behalf of the soldier. And that's part of why we're taking them out of the chain of command at the brigade level, to prevent any even perception that our SARCs and our victim advocates may be split in their focus between the command and the victim. So that's a part right off is the victim advocate. They're offered the opportunity for a special victim counsel, essentially a JAG officer who will represent them and provide them with their legal options, their rights, and to make sure that those are respected during the process of the investigation and the adjudication. They get access to behavioral health to counselors. They have the option of requesting an expedited transfer where we could move them not just a barracks move across post, but moving them completely to another PCS, to another location, so they're completely removed from the environment so they can begin the healing process.
That's helpful, but as I recall, a decade ago, hearing about women that reported having been sexually assaulted, raped, and they weren't moved, and they endured a lot of tires being slashed, cars being keyed, those kind of things, because they had had the audacity to step forward and make this allegation, and even to sometimes just be relocated on the same installation is problematic. So I'm hopeful that those kind of issues are being looked at more closely. Another question we have, it says, correct that correlation is not causation, but what are the top root causes of military suicide, and what specific steps are being implemented to reduce and or prevent death by suicide?
Again, correlation not being causation. The strongest correlations, typically we're talking about the junior enlisted ranks, E1 to E4, E5, creeping up a little more in E6 recently. But it's the junior enlisted ranks, it's men. Combat arms, MOSs are the most common. They have either individually or in combination some form of relationship, substance abuse, financial, behavioral health, or disciplinary related issues in one or in some combination. And then the most critical is they have access to a privately owned firearm. That's the most common means for death by suicide in the Army, is a privately owned weapon. One thing that we're doing is we are launching a campaign across the Army to address what we refer to as lethal means safety. And this is not to prevent suicide, you need to do certain things. We need to have safe communities, safe homes for our soldiers and their families. So we talk about safe practices for storage of firearms in the house, safe practices for storage of medicines. We're not doing this exclusively to prevent suicide, although we know from data that that suicide is often an impulsive act, which makes it hard to trace what's the cause. But anything that we can do to put time and space between the ideation and the act, which can be as little as 10 or 15 minutes,
Right.
having to open up the gun case, having to load the magazine, load the weapon, that amount of time can often be enough to cause somebody to pause and say, wait, let me think about this. The same thing with medications. If you no longer need a medication, don't keep these stored in the house. Turn them into the clinic, turn them into your firehouse. And we address it broadly in terms of safety. You don't want, this is an extreme example, but if you have small children in the house, you don't want to leave a loaded weapon sitting on the coffee table. You don't want to leave, medications or poisonous substances out where children can get easy access to them. It's about creating a safer environment at home. And my optimism in that is that, we have done things like this before. We have, all of us have learned to wear seatbelts. We've learned to use car seats that are properly sized and properly installed. And it's just because we want to keep ourselves and we want to keep our loved ones safe. So that's one approach that we're going to be pushing very hard in the coming months and years.
Oh, that's great. Thank you. Excuse me. Got a lengthy one here, and this may well be our last question. It says, can you speak to the Army's stance on the potential trade-offs between suicide prevention and privacy? For instance, several students show that location information from wearable, like Fitbits, like I'm wearing now, and social media posts are predictive of suicidal ideation. However, monitoring and analyzing these feeds are intrusive.
Every death of a soldier, particularly death of a soldier by suicide is a tragedy. It's a tragedy for the soldier, for their family, for their buddies, for that unit. Several months after I gave up battalion command, I was still at the installation, and we had a soldier who died by suicide, a staff sergeant. It affected me. I can still remember all of it, the details of it today. And I remember my chaplain and I both going to the memorial service for him, and just how devastated the entire battalion was over that event. So these are tragedies, and we need to work to prevent them. What we're trying to focus on is a combination of, first, the traditional training we have done that you and I are quite familiar with, which is the how do you, recognize the warning signs of a crisis and take steps to intervene. And, we have had soldiers come in the VICE's sessions saying, I remembered my training and this is what I had to do. And so I was able to put it to work and save someone's life. What we want to do is we want to get ahead of the crises, the kinds of crises that lead to death by suicide. We don't want to be overly intrusive. We have to be respectful of soldiers' privacy. And I don't think that we would want to be in the business of tracking every soldier's location on their Fitbit. That alone is going to increase stress levels on soldiers. And frankly, it's something that I think would potentially deter soldiers from either entering the Army or staying in the Army. So I guess in the trade-off, we want to respect soldiers' privacy. What we want to have is engaged leaders who know their soldiers, who are talking to soldiers, who can understand these are the issues they're facing, and here's how we can address it for you as an individual before it gets to crisis. We're going to bring a professional workforce on board that's going to look at it and say, okay, at this installation, here are the stressors, here are the things going on. Or if there's a formation that's struggling, you can go down to that formation and say, hey, 1st Brigade, things are not going so well. What's particular to 1st Brigade? Or 3rd Brigade is having positive results. What are they doing different from the other 2 brigades, the other 2 BCTs, that we could apply as lessons learned? That's how we want to approach the problem.
Well, when we were much younger and soldiers once, right? And
I think we're soldiers for life.
we're soldiers for life, absolutely. But you know, we knew our troops. We knew their spouses, their children, probably even the dog's name. And it seems now we've become a little bit unengaged. But I think the leading by walking around, and to your point again, we know what some of the causation is, or it seems to be there's a correlation, financial issues, relationships, especially these young soldiers, that first heavy, the first true love in their life, and there's a breakup, and to them the world has ended as they've known it, and they can't imagine they will ever be happy again. But if our leadership within the organization is aware that something like that has happened, we get our arms around it and say, okay, how do we get that young troop involved in something, basketball, some kind of sports, just go out and have lunch with them and just be that ear and that shoulder to cry on a little bit.
You know, and the things that you know, are still happening in the Army, probably not as often so, but the things, okay, who's in the barracks, who's going to be staying in the barracks over Thanksgiving weekend because they don't have any place to go, or it's too far because it's too expensive. It is knowing the soldiers. I think part of what we're seeing is, frankly, an outcome, a second order effect of so many years of continuous deployments to combat. When soldiers returned from combat and leaders, there was a natural I want to focus in on my family. I want to focus in on myself and my family and resetting myself for what is to come next. And I think that led us to not be as engaged as leaders as we needed to be. And that continued for so long, for so many of our leaders, that some of these skills have just eroded, and we have to address them. And again, going back to the IRC, you know, one of the recommendations is relook PME, which we were already doing, and TRADOC is redoing. Is okay, how can we focus in more on the communication skills, the counseling skills that our junior leaders need? You know, what are the things you can do when we talk about prevention of harmful behaviors? How do you establish a positive climate in your unit, you know, where it is, you know, taking care of your people is seen as part of the mission? So again, we've had a long and very difficult haul for the Army, in which, you know, our soldiers perform magnificently, but we need to do some resetting and some retooling of some skills that were just eroded over that long period.
I'm going to give you one last opportunity to make any closing remarks or statements you'd like to share with the audience.
I just thank AUSA for the opportunity today. Thank everybody, as I look over at the screen, who joined us today for this conversation. Again, people, mission, you know, we have to break that mindset. You know, people, taking care of our people is part of our mission, and that's essential to cohesive teams, to readiness, and to lethality and survivability on the battlefield. And it's a role that it's a process that's going to work from the enterprise level where I'm working, but really what's most important is what is going to be happening on the ground in the daily lives and daily experiences of our soldiers. That's where this is really going to happen. And again, why the focus is going to be on pushing resources down to commanders, the resources they don't have, the training for their leaders that they need, so that we can better get about taking care of our soldiers and being a better Army for that.
Oh, well said, Dr. Helis. Yeah. Thank you so very much for being part of this noon report today. And I'm going to throw it back now to SMA Daily. Thank you, sir.
Well, thank you, Chief Wilson and Dr. Helis, for that incredible discussion. Before we go, I want to inform you of a few upcoming events. On June 1st, we will host a Noon Report series with Stephen Moore, author of Patton's Payback, The Battle of El Guitar, General Patton's Rise to Glory. On June 2nd, we will host a coffee series with General Paul E. Funk II, Commander of U.S. Army Training and Doctrine Command, sponsored by Leidos. On June 8th, we'll host a Noon Report with Lieutenant General James Dubik, U.S. Army retired, on Washington's War, Lessons in Leadership from a Modern Army. There are some other really great speakers scheduled, and I hope you can join us for an incredible webinar. For more information about any of these events, or to register, please visit our website at ausa.org. Finally, we want to thank all of you who support us with your membership. Membership matters. You help us support the Army with your membership. Thank you again for attending, and have a great day.